this program of The Health Talk. Today we are commemorating World Health Day, and the theme for this year is Everyone, Everywhere Can Access Quality Health Services. In this edition of the program, we shall hear from Shandell Boyce, who is the former Junior Member of Parliament. She will discuss some of the challenges that are being faced by the youth in accessing health care, while also she tries to offer possible solutions.
So this is Chantal Boyce speaking, a former member of the Child Parliamentarian. So I'm here to shed light on the issues affecting youth in accessing health care here in Zimbabwe, and also how COVID-19 has affected the SRH services. Despite this pandemic, the need for sexual reproductive health information and services is still at of paramount importance. For most young people, for most youth, sexually, these services are still essential, especially contraceptives, so that we avoid unwanted pregnancy in such a hard economy that we are going through. So most health services systems have shifted our focus to COVID-19 response, but we should also take note that during this pandemic, in this lockdown, many people have been sexually active because they have been ordered to stay at home, and you find sex is the best alternative to spend time because you'll be logged in. So what I'm saying here is we have increased the increased number of unwanted pregnancies and some other sexual services which were not offered during this lockdown, which includes for the HIV testing, SRH services. All these services were not being provided for because one would require a letter to travel from this place to the next point. And also, let me say something on youth besides the COVID-19 era. I would like to take you back, issues affecting youth. So as youth, we will find out that many people, they are very shy to go to the nearest clinic to look for health, for SRH services, like to get condoms at the clinics. They prefer to buy, and others, if they don't even have the money, they will just do unprotected sex, which is also risky because you have so many STIs, and even one is infected with STIs. The youth of today, they can't go to the nearest clinic to seek services because I could like to say it is because of the way they are taken when they reach to the clinics in search of such services. They will be given so many negative responses, which holds them back from reporting such cases, from seeking help, from seeking services. So we find out that many youth, they get these STIs and they stay at home. They rather tell their friends so that to seek some medical advice, what they should do, this and that, because they can't reach to the clinic because of the negative responses they'll be given, which is also disturbing. And we should also I think that there is need to have condom pickup points where people should just deliver the condoms there, and anyone could just go and take them, just like the suggestion box. So I think that will help because, like I've mentioned, youth, they are they get very shy to even access these condoms, these contraceptives. So I think there should be a friendly youth spot where we can get to collect such items and prevent ourselves from getting, because really abstaining is not the answer to this as of now. We can preach the gospel of abstaining, but we should also know that most of the youth, they are already indulging. So there is need to protect them and to save their lives by giving out what can be offered to help them. So basically these are the key issues affecting youth. Yeah.
also shed light on how costly it is for the youth to access healthcare. Some youth in the rural areas, how do they get access to health considering the economic woes in the country at the moment?
Considering the economic hardship of our country, Zimbabwe, the inflation rate, this and that, you find out that not everyone can afford to buy these condoms. They differ in the places where you are getting them from. If you buy them in a market shop, like if you get them from the OK shop, the last time I checked, it was $94, and you'd actually find out that not everyone can afford that, because these youths which are busy indulging in sex, they don't have anything more to do, anything that is valuable, anything that is productive, which can give them money. They are just fighting to get data to get bundle money. They don't even think of buying these condoms because they find those as an expense. So that's why we have a high number of youth just indulging in unprotected sex. So on the other hand, we can blame the hardship of the economy because these services are supposed to be given for free. Yes, we can acknowledge that we have other centers where they are given for free, but it's not everyone who can reach there. We have people in rural areas. Think of someone who's living in a disadvantaged rural area who can't even afford to have something on the stomach. Would that person afford to buy condoms which are going for nearly $1 US? So you at the end of the day, you actually realize that it's next to impossible. That's why people are just indulging in unprotected sex. So yeah, that's it. And also here on the sanitary way for girls, yeah, it has been a very, very sensitive issue because we see that as the economy gets hard, it doesn't make any girls stop to go for their menstruation. Each month comes and you have to go for your menstruation, whether you have the sanitary way or you don't. It's something that we cannot run away from. It's something that happens on a monthly basis. So you would find out that we have some organizations who provide such services, but what has been my cry is that you give them a pack or 2 packs today. They can cater for the whole month, but will you be back in the next month to give them another pad? That's why I always encourage to have this washable, reusable sanitary way. And if you can get a reusable, you can use it from 3 to 6 months using just maybe 2, exchanging maybe 2. So with the cost, not everyone can afford that, because the last time I checked, the last time I bought them in Spa, they were going for something like $20, $20. The cheapest ones, they were going for $20. So you see, not everyone can afford that. Let's think of girls who are in rural areas. Let's think of girls who are vulnerable, girls, the disadvantaged families. Will they be able to access such? So this is hard for us as girls, and it is more harder than for girls who are in rural areas. So basically, that's what's happening. And also on that same issue, for others who are in rural areas, it is also hard to travel from one point to another because of the distance which is there for you to reach to the clinics. And if you get to the clinics, it's not automatic that you get the services. Maybe they are out there, they have the shortages of such condoms, you can't get them. They are not even providing such services. I have noted that most of people who are trained and who you can find on the clinics providing the SHRS services, they are mostly in urban areas. But in rural areas, they are just on maternity. They are mainly based on maternity and other things. But we can't deny the fact that people are indulging. Sex is a daily activity to others. So we should be more protective on that one, so that we keep on running away from unwanted pregnancies and because our economy at this rate, it cannot allow us to be overpopulated and be overpopulated again. So I think the best thing is just to provide such services. Thank you.
We're listening to the Health Talk program brought to you by the Community Voices Zimbabwe. We were exploring the challenges faced by youth in accessing health care in Kwekwe. I'm Perseverance Jalangwe. Stay safe and goodbye for now.